Hi, my name's Gary Earle, and I'd like to welcome you to the CIGNA Health Awareness Tour Mobile Learning Lab. Come on in and let's see what we can find out. This is the entrance into this learning experience. What I'm going to share with you in a few moments are the 6 areas in which you too can learn about health, awareness, individualism, and the communities in which we serve. Come on aboard. In this area, area number 1, we talk to people about the unhealthy truths about health. This is where anyone who comes on board as a guest will begin to learn about health statistics, what it is that's really impacting our nation, from areas such as obesity, diabetes, hypertension, and beyond. This is an area where people can literally sit down and start to think deeply about 86% of Americans that are about to be overweight by the year 2015. This is where they'll begin to think about this as an individual. Over here on wall number 2, or learning area number 2, this is where we're going to help people begin to think about what it is that might actually influence health. When we talked about obesity as an example over here, or diabetes, is it a lack of exercise? Is it poor nutrition? Is it genetics? Or are there things in our environment, social elements, that might also influence health? In this learning area, which is a map of communities, you'll be able to understand and consider where people live and the influence that that might have on their health. People will be able to look in each area of a zip code to look at health statistics as well as community conditions to consider, if I have more grocery stores than you do in your community, does that impact my obesity rate? In learning area number 3, we begin to now think about this from an individual perspective. Here we have 3 interactive kiosks, systems in which you can enter a card and begin to learn a little bit about a story of an individual. We have 12 individual stories, completely diverse, that speak to someone's health condition, and at the end of the day, help you tie together those last 2 walls, which is what might it have been that fundamentally influenced that person's health. A very quick example would be this gentleman named Wilhelm. He's a worker who happens to live in Poland. The question is his obesity, hypertension, and depression related to how he lives, or is it about how he's treated in the workplace? And in his case, he has a supervisor who has mistreated him, which means when he goes home, despite our best efforts to encourage him to eat better and exercise, he really can't. His heart needs to be healed before the body's healed. Each one of these stories takes us through diseases, outcomes, and good news stories at the end. If we change our thinking, we help change Wilhelm's life. This is where we come into area number 4, so that the individuals can start to think about actual things that they themselves can do to improve their lives. Here we have an example of a 20-pound, I don't want to pick it up, 20-pound fat jacket. This is not to poke fun at someone who might be overweight. This is to help each one of us understand what it might be like to carry an additional 20 pounds on our body. And by the way, if I was an employer in here, I might be thinking, how does this 20 pounds impact my workplace? The people that must be lifting things every day or climbing utility poles. How does that 20 pounds impact them? This gives me a little bit clearer way of understanding that. We also like to teach in here. So we want people to understand how to eat properly. As an example, portion control. The size of the protein, is it the size of the back of the hand, or in our case, a deck of cards, or do we overeat those steaks that we always have? So what we're doing here is trying to help people think through that. And lastly, very interesting, what's in your food? I wonder if each one of us that's watching this would know how many teaspoons of sugar might have to be in that one small 12-ounce can of soda. Well, here you can figure that out. You'll find out that it's 14 teaspoons of sugar in 1 can of soda. And by the way, with diabetes increasing at the rate it's increasing in America, and quite frankly globally, this is a big part of the problem, no doubt. As we come into area number 5, this is about community. This is about looking each other, looking ourselves in the eye. Say, what can I do to step outside to help others? We invite children on board, we invite adults, we invite people of all diversities and aspects to come and now start to consider, after they've become aware of conditions, starting to learn about what they might be able to do as individuals, how do I now influence the community? Change your attitude. Stop looking at people and judging them for who they are. Start to consider where they came from. Look beyond yourself and think about the people in your own life, work, school, church, the gym. This is an area that gives statistics, this is the area that gives people an opportunity to think about what it might be that they can do for others outside of that community. And lastly, we have a learning wall. And this is a place where people can begin to make pledges about how they might want to do something better with their life, or at the same time, they may want to write down something that might help us learn how we can help people live healthier, more productive lives. And then as we leave, we just hope people are inspired, get involved, and begin to consider taking action. That's what this is all about. It's an experience, it's a learning experience, because at the end of the day, if we really do believe that our goal is to improve the lives of all people, this is a place where people can begin to consider what that really means from an awareness perspective, an individual perspective, and a community perspective. With that, we welcome you on board and hope you can join us on one of our tours soon. Take care and have a healthy year.